Hey everyone, I'm Amanda from Prana Thrive, and this is Tracy from Prana Thrive. And today we are going to talk about IBS and reflux. So we're going to talk about some of the symptoms associated with IBS and also some of the microbiome reasons that people are experiencing IBS or reflux. And Tracy and I both work with clients in understanding their gut bacteria, in helping them to address a whole range of health issues. But IBS is definitely one of the areas that we have a lot of experience and have a lot of clients come to work with us to address. Tracy's going to start talking a little bit about some of the symptoms, and then I'm going to go into a little bit more detail around some of the different bacteria.
Sure. So would you like me to talk about the symptoms of IBS, or would you like me to
Yes.
talk about the symptoms of reflux and how to identify the difference between the two?
Yeah, I think start with IBS would be great, and then we'll talk about the
Sure.
reflux as well.
Okay. So IBS is irritable bowel syndrome, and anything that's called a syndrome is really a collection of symptoms that don't have any real identification, of course. So it's really a name put to a condition that there is no exact pathology going on. So it can be quite hard to identify, but really, if you are experiencing a change in bowel habits, maybe constipated, maybe you're having loose bowel motions where the stools fall apart at the bowl, or you're having a combination of both, you'll often have some bloating, some gas, some reflux, so indigestion type symptoms. So when you're having those symptoms, you really need to make sure that there is nothing more sinister going on, because they can be signs there is something going wrong that really needs addressing. And once you have gone and had all the tests to make sure that there isn't anything more sinister, then if that comes all clear, often your diagnosis will be called irritable bowel syndrome.
That's right. And that's definitely one of the areas or one of the situations, I should say, that many clients start looking for information as to, or the people that can help. And that's definitely the areas that we focus and be able to help clients after they've had those medical tests done, or even in the process of as well. Sometimes it's an area that we may recommend so that we've got all the information as far as understanding where the symptoms are coming from. So, but yeah, and that's, I guess reflux, you mentioned, Tracy, is a really, really common symptom that clients do come to see us for. And whether it's reflux in combination with those IBS symptoms, or for some people, they're experiencing reflux and maybe not aware of those other symptoms, or even people are being diagnosed with a type of reflux and they're not experiencing that very common heartburn feeling, but some medical tests like endoscopies have actually identified that there is inflammation there. So did you want to talk a little bit about the difference with reflux?
IBS?
Yes, sorry, yes, yep.
Yeah, sure. So I guess reflux is part of that syndrome. So you may have it alongside your IBS, or you could have just the reflux by itself without actually having irritable bowel syndrome. So often, if you've just got that reflux by itself, you wouldn't have as many issues with the stools. Yes, you can still have constipation or loose bowel, but you don't tend to have a change in the stools as drastically as you would with irritable bowel syndrome. So yes, you can have the bloating with reflux, but it really comes down to taking a full medical history and looking at what tests have been run. What do you have? What do you not have? And so it really is a process of elimination. So it's tricky. It really is. And even as a practitioner with lots of experience, it still is tricky. So that's when, we just got to get laser focused on taking a really good medical history to pull together the pieces of the puzzle.
Yeah, that's right. And that's something that Tracy and I do when we first start working with clients, is having that initial consultation to get all of that information, asking all of those detailed questions as far as when do you experience that symptom? Is it before eating? Is it after eating? How long is it after eating, for example? The severity, the type of pain, all of that information gives us a really good extra understanding as to what's actually going on in the digestive system and where those symptoms are being contributed or triggered by. And so then looking at, we also use ourselves, we then highly recommend using a gut microbiome test, because that's a great way of understanding the whole picture of your microbiome. So whether that's linking to IBS symptoms that Tracy's just mentioned, or even for people who do not have those most typical IBS symptoms, if they are experiencing maybe just bloating or reflux. I find that's very, very common. I see many clients with bloating and reflux, but maybe not the other changeable bowel motions or other food reactions and so on. And so really then understanding their microbiome and where there is inflammation or where there are deficiencies that do link back to those symptoms, because there is, our gut bacteria is really important for controlling a lot of different types of inflammation in the body. And so we can really start to understand where that bloating and reflux and other symptoms.
Yeah. And what came up for me when you were speaking earlier was that because the symptom picture is so important in helping sort of understand what's going on for that person, it's really imperative that the client understands their symptoms. When is the bloating occurring? When is the reflux occurring? Is it immediate? Is it later on in the day? What are the signs and the symptoms? What exacerbates it? What makes it better? What makes it worse? So all of that sort of information helps us as a practitioner get to the root cause much more simply and
Yeah.
quicker.
Definitely. And, that's something I find a lot of people are very aware of those symptoms and timing when they first come to work with us. And some people are not aware until we start asking those really detailed questions. I've had some very aha moments for some clients as well when I've gone through those different symptoms and we've really identified the timing or triggers for those
Yeah,
symptoms. And that starts to give us a lot of extra information as well, which is great.
absolutely. So
So,
many people have gone through that path of going to the doctor and having a whole range of tests, some small amount of tests, and some people have actually had quite extensive
mm,
tests. And what I get most commonly is that they are left with not a great deal of solution to
mhm,
actually resolve the issue. They end up being put on a restrictive diet that has no end to it. Like
mhm,
there's like, how do I actually heal from this? Because I can't be on this restrictive diet all the time. It's causing me stress. It's causing family stress. I can't eat out. I can't go to this restaurant. So I just wanted to emphasize that there is a cause. There is a cause to your IBS and there is a solution, and it
mhm.
just needs to be found.
That's it, definitely.
Mm,
So, and I'm going to talk a little bit about some of the different bacteria. One that I find is a very common, not in all cases, but I would say probably about 3/4 of the clients that I use microbiome testing with will identify a low or possibly even zero detector level of a bacteria called Akkermansia. And Akkermansia is so important for your gut lining. So it really helps to provide a very protective layer along your gut lining cells. And so when you have a low level or missing that particular bacteria, then your digestive lining becomes inflamed really easily. Certain foods like gluten and dairy, sugars, processed oils, for example, they are much more likely to be then food irritants to the gut lining. But for some people, and probably for us, many clients that we see, they are actually starting to react to all foods, or maybe each time they eat, or maybe certain times of the day when they're eating, their gut lining cells are just reacting and triggering inflammation. And that can really create a cascade of many different symptoms, but some of the most common IBS symptoms, like your bloating, either loose bowel motions or constipation or both. I would see many clients that experience actually both, have quite a cycle of irregular bowel motions, but some level of pain or inflammation. Some people feel like a heat in their body after eating certain foods, may even get a skin rash. That's quite common, actually. Skin rash, either a more severe would be more like a hives rash situation. But I have a lot of clients that experience more of a skin flushing, which then disappears, but then comes back again very frequently. And then, of course, reflux is another symptom in combination with those digestive symptoms. And so Akkermansia is just such an important protective bacteria. So that's one of so many bacteria that we look at in a microbiome test to really understand your levels. And if they're low or missing, then we know how we can really build up that Akkermansia. So using certain foods, using certain probiotics, but there's usually a particular sequence of healing that we recommend, and that really comes down to each individual person as well, depending on the severity of their symptoms and all the other information that comes from their microbiome test. But I would say that, yeah, if we had to, they're all important bacteria, but if I had to list one that was probably the most important to understand in relation to IBS, I would say it's Akkermansia. So I'm sure you agree, you'll find that with your clients as well, Tracy.
Yeah, absolutely. And I think sometimes it can be really tricky to know where to start because some people's gut microbiomes, there is so much going on.
Mm-hmm.
And it's like, where do we start with this? And yeah, that can be really tricky, but absolutely, Akkermansia has to be restored 100%, a given.
That's it. So there's a couple of the other area that I see with a lot of clients, especially with more the IBSD, which is the diarrhea or the loose bowel motions, is often a high level of pathogenic bacteria. So pathogenic are inflammatory bacteria that are producing certain toxins. Every person may experience different symptoms or have experienced a different effect, I should say, from those different types of bacteria. But one that I do see very regularly in high levels is Shigella. And so Shigella is a type of E. coli, and if we have high levels, we're much more likely to have diarrhea. Now, in a more extreme situation of food poisoning or travel gastro, when people have maybe picked up this type of bacteria, because it is one of the more common food contaminating types of bacteria. But often when we go back through a case history with our clients, there may have been a point where they had a very severe gastro situation, and then their symptoms have really improved, but then for years now they've ended up with more of a long-term IBS situation of like daily loose bowel motions, not to the point that they feel really, really unwell, but definitely enough that is creating, pain, bloating, and so on, preventing them from leaving the house or making it difficult going to work or going out because always feeling like they're not sure when they're going to need to use the toilet. And for a lot of those clients, they have this very high Shigella level that is contributing to that symptom. And so that's an area that I've definitely had amazing results with clients that have had years of IBS, thinking that it was all the foods, and they've eliminated, like Tracy said, followed a restricted diet, eliminated the different foods, either felt, some benefits, but ultimately not been able to resolve that symptom. Once we've really understood that level of Shigella, or there's a few other associated bacteria that I commonly see as well, then we start working on addressing that bacteria. So Tracy and I are both functional naturopaths. We use some really specific supplement in relation to addressing microbiome imbalances. So if we're looking at any pathogenic or inflammatory bacteria, we know there are certain remedies that are classed as antimicrobials. And so the types of remedies that we'll use are very specific, tested and proven, sometimes for even those very specific types of bacteria. And so once we start addressing that, it could take a month, it could even take a few months, but loose or diarrhea IBS is something that I have seen sometimes resolve extremely quickly once we've addressed those types of bacteria, because they've really been in that person's system sometimes for a very long time. So it's excellent to see then those symptoms improving or even bowel motions totally coming back to normal function by addressing those really inflammatory types of bacteria.
Yeah, I have commonly seen the pattern of someone's had food poisoning years and years ago, could
Mm,
be 15 or so years ago. It's not a recent thing. And ever since then, they haven't been well, but they have had their stool sample tested and there is no parasites or anything like that.
oh, yeah.
I think what may be occurring is there's such level of inflammation going on in the gut from that onslaught, from that
Mm,
initial infection. But when the infection resides, that dysbiosis, that imbalance, and that inflammation is still there.
that's
And
right.
then it causes like a cascade of things that then eventually roll on from that event. And
Yeah, that's
yeah,
right.
people have been suffering for so long, and then we
Yep.
do their gut microbiome, and it just gives us so much information, and it means we can be really targeted with restoring balance to the gut.
That's right. And sometimes I find it's that initial infection, travel, gastro, or food poisoning, that they've maybe initially just gone to the doctor and maybe certain bacteria did show up in that acute situation. They've been prescribed antibiotics, and the antibiotics have definitely worked in enough of a way to resolve that acute situation. But then, unfortunately, what's happened is that those antibiotics have actually depleted some really important good bacteria, and we have many different types, and so including Akkermansia that we just spoke about. So it's very common then to see initially a reduction of that acute situation, but then the long-term impacts of maybe that course of antibiotics already on a microbiome that was potentially out of balance. And then often we still even see those original pathogenic bacteria there, because even though antibiotics may have helped to reduce them, it didn't eliminate them. And some bacteria are quite clever. They create a biofilm and they become antibiotic resistant. So I've seen levels in clients extremely high, sometimes after many courses of antibiotics, and then I've used particular remedies that I know are very well tested and proven for those bacteria. And that has, when we've done retesting later, that has totally resolved the situation with those particular bacteria, which is excellent.
Wanted to talk about antibiotics and their impact on the gut just briefly.
Mm,
That a lot of people think that antibiotics wipe out all of the bacteria in the gut,
mhm.
but that's not the case.
That's right.
They're not over. They wipe out a lot of bacteria, but not everything, right? So what
Mhm.
ends up occurring is we get this opportunistic bacteria that kind of come in and take the space of the other bacteria that have been died off. And the easiest way to sort of imagine what's going on here is very commonly women in particular will get thrush, vaginal thrush, or
Mm,
mouth oral thrush.
yep.
And that's because the candida is there. Everyone has a little bit of candida, but it's when it is growing too high. So
Mm,
the antibiotics kill off some bacteria, and the candida is opportunistic.
that's
So
it.
that starts to grow. Often, when a patient comes to me before they go on to the antibiotics, because they actually have to have the antibiotic, because let's face it, antibiotics are life saving. They don't need to be used as often as they are prescribed. If you do
Mhm.
have an infection, not always do you need antibiotics, but they are life saving and they are necessary in some circumstances. So I would often then support them when they're on those antibiotics
Mm,
with an antimicrobial. So we are killing off more of a wider range of bacteria, and then we rebuild and support the immune system afterwards. Yeah, if you can get in contact with your practitioner before you go on the antibiotics, you can get that support there, which will lessen the side effects.
Yeah, definitely. And that's a really great point, Tracy, because I just had a thought about some of the emails I get from clients when we're already in a program and we're working on their areas of health, and then something happens where they do need to take antibiotics. So whether it's for some sort of dental infection or surgery, or even just acute infections that might come up in the meantime. And often I get the question, or they even just tell me, thinking that they were doing the right thing before they contacted me, that they just stopped all their supplements. They're like, "Oh, Amanda, I just stopped taking everything." Or should I stop taking anything? I need to take this course of antibiotics for the next week. And of course, yes, maybe there are some remedies that are best if we just wait, but so many things can be very supportive. And there's a lot of research now on certain remedies, like Tracy just pointed out, antimicrobials, that actually are proven to have a increased benefit when used with antibiotics. And then there are certain probiotic bacteria that are actually very, very helpful in that acute phase as well. Now, they do always need to be taken at least 2 hours away. So a probiotic should be taken 2 hours away from an antibiotic. But there are certain probiotics that are extremely helpful in that with antibiotics or in that course of antimicrobial stage. And then there are others that we want to use afterwards to really, help to build up any bacteria that have been affected. So so there's different situations where we can use different remedies together, definitely, to help to deal with
I
it.
thought you were going to say patients commonly say, "I've undone all the good work
Oh,
that they've already done."
that too. No, I should say that. I get alarming help emails of clients thinking,
Yeah.
"Oh no, in a week's course of antibiotics, I've undone 3 months of amazing gut healing." No, there may be, and everyone's different, because it really depends on what we were starting with. It depends on what their microbiome, what stage in the process of healing we were, or what was originally showing. So I definitely have some clients where a short course of antibiotics has definitely set them back, not to the very start, but definitely has set them back a few steps. And I usually can tell that by their symptoms, because they've had quite a negative reaction. And then I've had many other clients that have said, "Oh, look, I needed to take them." And I was shocked at how I didn't feel any negative effects to those antibiotics this time, whereas I have definitely in the past. And that just shows how much that we've already addressed and balanced their certain areas of their microbiome, that then those antibiotics haven't had such a negative impact. So, yeah.
And want to keep moving on from antibiotics, but I do want to
Yes.
say this is how the antibiotics can really impact moods.
Definitely. Actually, yeah,
So,
that is a big one. I've definitely had a lot of clients that have had quite a setback or a flare up of anxiety and mood issues due
yeah,
to a course of antibiotics. That's right.
yeah,
And that then
can
helps
make
us
you
to
feel
understand.
really depressed.
Yeah,
Yeah.
definitely.
If you're susceptible to depression, it can make you very depressed. If you're susceptible to anxiety, it can make you very anxious, just
That's
low,
it.
flat moods. But
Yeah.
maybe we can have another topic just on antibiotics.
Yeah, I think so. Definitely.
So often people have had a diagnosis and just then left with how do I heal from this? I can't live with this forever.
Mm.
I haven't been given any real solutions. So let's talk about some solutions.
That's right. So when clients first come to work with us, what we're looking at is, asking all those important questions, understanding the timing and severity of their symptoms, where some of those triggers are coming from. Was there original infection, gastro, food poisoning situation or not? Were there other stress factors and so on that have started? And so then what we do is we start to look at, the person's diet, just seeing, are there some really obvious foods that are contributing more inflammation? But what I find for a lot of people is that there is so much information around inflammatory foods now that often people have already looked at the food triggers. They've understood foods that they react to more. They've reduced them or even totally eliminated them. And so then what I look at is, what are the really important foods that we can introduce more of to help with the start of a healing process? So now Tracy and I, all the clients that we work with, we use microbiome testing. So once we have those microbiome results, we have a much more detailed picture and understanding. So then that treatment plan is much more specific. But while we're waiting for those test results, there's so much that we can start to understand, because we really have been doing this for a long time. So one of the areas I find is that often people are just not eating enough fiber. That might sound so simple, but sometimes it's the types of fiber. So, when I'm looking at someone's diet and the sorts of foods that they're having, yes, they may be having the regular fruits and vegetables and so on, But for example, I talk to clients about introducing more seed fibers, so things like chia seeds, flax seeds, hemp seeds. Often ground, having them in a meal sort of form is really helpful. But just a simple combination of maybe having a little bit of coconut yogurt with some berries, some seeds, mixing it together, that type of meal that could be had for breakfast or even as a snack is something that I find a lot of people are doing, but many, many clients, I've recently had so many clients that have never tried that combination. And it's just such a great pre and probiotic source of anti-inflammatory foods that can really start to support the person's beneficial bacteria, because that's what we're wanting to start to feed more of those important bacteria. And so we can start to do that with some foods to fuel that.
I guess my approach is really just finding out what foods are aggravating them and keeping them aside while we actually start to work on the gut microbiome.
Mm-hmm.
And then I introduce more foods later on just to give that client relief. So yeah, I think introducing too many prebiotics, probiotics, fermented foods, and too much fiber can be so upsetting to a gut that has dysfunction.
Mm-hmm.
So once I can really quickly identify the foods that are causing patients issues, and it can be really tricky for the client themselves because there's often not just one group. Like it's not just FODMAPs that are causing you issues. It could be 3 things, right? It could be gluten. You may not be celiac, but you're reacting to gluten.
Yes.
You're reacting to FODMAPs and you've got a histamine issue, right?
Mm-hmm.
So people are like, oh my God, like how on earth do I figure out what foods I'm reacting to? And plus stress will exacerbate your reaction to it.
Definitely.
So if you've had a busy week, you've had a major stressor just recently, or you just completely run down, you're going to react greater to those foods. And also then you've got the compounding effect. So you've just had 3 foods, 4 foods on top of one another that you could maybe handle one of them by themselves, but having a group of them together. So it's very tricky for people. But I guess there's no simple solution other than let's try and eliminate what we do know whilst we work on the root cause.
Mm-hmm.
And then you can start to include those foods back in your diet. It won't be forever unless it's a true allergen or celiac.
Mm.
And there is obviously foods that we don't want in the diet, inflammatory oils and lots of sugar and too much carbohydrates, because quite commonly I see too much carbohydrate and not enough protein in the diet, to be honest.
Yeah.
But, we need those building blocks to actually heal the body, because the amino acids create connective tissue and gut lining is connective tissue that we need, all of that protein and amino acids. So, yeah, we really look at diet and guide the client through what is right for them, because there isn't a one-fits-all approach. And I think that is why people get so stuck in not being able to heal, is because they are approaching it as I've got IBS, this is what I need to do. No, you need to do what's right for you based off your unique circumstances, and your gut microbiome is the tool that we use and find incredibly effective at getting fast results. So we treat the whole body. So we don't just look at the gut microbiome. We look at how is stress impacting the digestive system? How is stress impacting the brain, that gut-brain connection? How is the thyroid? How is the liver? Et cetera, et cetera, et cetera. So we treat the whole body, which is imperative. You can't just treat the gut. Looking at medications, what medications is that person on? So very commonly I see B12 deficiencies and iron deficiencies in people with inflamed guts, because iron is, well, for 2 main reasons. Iron is necessary in the inflammatory pathway. So if you've got lots of inflammation, iron is being used up in the biochemistry. So you start to see a decline, but also you need really good digestion to be able to absorb iron and B12 at the intrinsic factor at the upper gastrointestinal. And then, of course, you make your own B vitamins from the bacteria, the microbiome. So it's a compounding effect when the microbiome is out of balance and you don't have that bacteria to help boost up those B vitamins. So getting back to the medication, if you're supplementing with iron, that can be causing constipation.
Mm-hmm.
And if you're not going to the toilet regularly, what happens is you get this stagnation in the gut, which literally you should be passing a stool every single day, and you should have a transit time of 12 hours. So if you are not doing that, it breeds dysbiosis, imbalances in bacteria, because it's just a breeding ground basically. So codeine can do the same thing, make you constipated, not having complete elimination of your stool. Proton pump inhibitors, so if you do have reflux and you've been diagnosed and given medication, the proton pump inhibitors stop the gastric acid in the stomach. It makes it decrease. So then that's the first line of immune defense. So we are more prone to infections, gastrointestinal infections, as well as lung infections. And being on them long term, you're not supposed to be on them long term, but I then start to see major deficiencies around the 3-year mark of people being on them. So if you're not getting good stomach acid is there to help you digest, particularly protein, but it's also needs to be the correct pH. So the proton pump inhibitors are lowering the pH of the stomach, adjusting the pH, actually raising the pH of the stomach, I should say, which makes it not as acidic.
Reduces the acidity,
So then you don't have the correct pH going into the small intestine. So it's this snowball effect, which then doesn't release enough bile, it doesn't release enough digestive enzymes from the pancreas. So everything we would look at, how well are you chewing your food?
Oh, yeah.
Because that is the start of digestion. That's when... Are you smelling your food? Because that's we know we start to salivate.
Yeah.
Are you eating mindfully? So I won't keep going on because we're running out of time, but this is the sorts of depth that we go into. This is the sorts of things that we look at. We don't just look at the gut microbiome. We don't just test that. We look at everything, what medications are impacting your gut as well.
Yeah, that's a really great point, Tracy. I'm glad you mentioned that, because medications are definitely potentially overlooked, or a lot of people don't realize they're taking a medication because they've been prescribed it. Their doctors told them why they're taking it, but not any awareness of, yes, if it's a short term, it should be stopped at some point, or the negative side effects, or not even side effects that can be felt, but the negative impacts, especially on digestive health, that ultimately is creating more of a situation. I definitely do see that with a lot of clients. So yeah, it's important for us to discuss, to pick those things up, discuss them, and look at where we can start to make some changes.
So I just wanted to mention that non-steroidal anti-inflammatory drugs will really impact the lining of the gut. They're one of the biggest causes of ulcers and spontaneous bleeds.
Yeah.
And also serotonin selective reuptake inhibitors, antidepressants, can slow motility, make you constipated.
Oh, definitely. I was going to mention.
So we want to make sure that...
And sometimes
there's more drugs. There are more drugs. We're just naming a couple.
Definitely, antidepressants and sleep medication, which is a crossover of some antidepressants that are used for sleep. But yes, I definitely see constipation particularly as a side effect of those medications. So helping clients to be able to reduce or come off certain medications is something we really focus on as well. Excellent. Thank you, Tracy. I think we've talked about a lot of different symptoms around IBS. We've talked about some of the ways that we assess IBS using testing, but also through our questions. And then some of the ways that we start to address that IBS. We've really only touched on that. There's so many ways that we do start to support, whether it's leaky gut repair that needs to be addressed, whether that's high pathogens that I touched on, really building up some important digestive bacteria that digest carbohydrate foods, bacteria that digest protein foods. If you have that high histamine situation, then you can be reacting to a lot of inflammatory the inflammation is going to cause a reaction to those more high histamine type foods. And so really understanding your microbiome picture in combination with then the very specific treatment plan that we create for you to really start working on addressing those stages and really healing and building on the microbiome. So, and that's ultimately how we help clients to resolve, IBS, because I think a lot of people are told that IBS cannot be resolved, that it's something that they just have to now live with. And that's a terrible thing to be told, because it is definitely something that can be resolved. And we help clients to do that every day. But there's not a one size fits all. It's often not a quick process either. Obviously, we always aim to get our clients fast results, but there usually is a number of things that need to be addressed, and it takes a certain amount of time to do that as well. But that's what we really help people through that whole process, to understand their IBS, address, reduce their triggers, address their areas of their microbiome and any other factors that we think are further contributing, and ways that they can be healed and resolved of those terrible symptoms.
So I just wanted to share that I will be doing a webinar on IBS in a couple of weeks. People will have opportunity to ask me questions directly.
Yeah.
So if you think you're experiencing IBS, or you've got constipation, loose bowels, diarrhea, gut pain, bloating, gas, reflux, jump on board and use the opportunity to have your questions answered.
Yeah, that's excellent. I'm really looking forward to that, Tracy. So,
yes.
All right. Well, thank you everyone for listening. I hope you found that helpful to understand maybe where some of your IBS symptoms might be coming from, but also ways that can be helpful. So thank you for listening. Thanks, Tracy.
Thanks, guys. Bye. Thanks, Amanda.
Thanks.